think we will go ahead and get started. We'll call the meeting to order, and, so Joanne, you can go ahead and mic us up. August 3rd, it's a special meeting, and we'll start with the Pledge of Allegiance. Pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, Sue, you want to do a roll call?
Certainly. Lyle?
Here.
Corte?
Here.
Walters?
Present.
Cook?
Here.
Bartlett?
Here.
Escortate here. Friend?
Here. Awesome, thank you. And thank you, everybody, for making time to be here tonight. Really appreciate it. On our agenda, we have the request for emergency medical services with East Bay Ambulance. It's the only thing on our agenda. Does anybody have any, we are all here, whew, to add or change or anything, or we're good? We all know what we're here for, so we'll move on, okay? Any conflicts of interest? Don't think we'd have any. Public comment? Any comment? Okay. Correspondence, we don't have any in the packet with this. And so we'll just kind of get right to it. So with that, we have Nick Lemcool here, who is the director of our ambulance. We also have in the audience here, we have Chief Pat Parker with Metro and Doug White, the supervisor from Acme Township. So thank you three gentlemen for being here tonight.
No problem. Thanks for having a special meeting so we can talk about this. We're just going to kind of go through real quick what we're doing, why we're doing it, and how we're going to get there. So back in March of 2021, Supervisor Doug White from Acme Township reached out to us. They determined that they were having some issues with ambulance cover in their township. And they know us being neighbors and know of our service. So he reached out to us and said, what can we do? How can we help fix this? From then, Beth and I sat down and we put pen to paper, tried to figure out how much it's going to cost, how to make it work, what's the best solution, is it even possible for us to do this? And then through that, we did that April through June. We talked about it with us, this board here in June as well. And then in July, we talked to Acme Township's board. And then here we are now talking about it further in depth. So why would we do this? What are we looking for as we do this? So we have a good ALS transport system right now. The issue that we have is we oftentimes only have one truck that covers just our township. During this, we also get called out to Garfield Township, we get called to Blair Township, we get called to Acme Township, as well as Whitewater Township for mutual aid. When we do that, we only have one truck, so oftentimes, if we get a call back in our township while we're in a different township, there's a long wait time for that. Sometimes, there was one instance that we had Blair come into Tibbetts Lake Drive, which was a 25 to 30-minute response time. So doing this, we would add a second truck to our system, and we would be able to have that redundancy and a backup that we don't need to rely on Blair Township to respond from further away. We miss approximately 65 to 70 calls a year that MMR or our mutual aid partners do cover for us. Typically, it's MMR. However, in that circumstance, we get Blair. Down River Road, we'll get Blair. Kind of that back part, we might get Paradise Township. Or we could end up with the city. With MMR, we don't know where they're coming from, or we don't know if they're available. Typically, if we're responding into Garfield Township to cover a call, or Acme Township, that means they're unavailable. Therefore, it just elongates that wait time for another ambulance. So another reason we could do this too is to maintain and develop continually good working relationships with neighboring communities. And then we've developed a very stable EMS agency within our township for the last 30 years. And then this is an opportunity for growth, collaboration, and consistency amongst our township and other townships. Excuse me. In July, Acme and Whitewater had a conversation, and Whitewater talked about maybe the potential of joining in on this agreement as well. So Acme Township would cover about 400 calls. It's just under 400 calls. And then Whitewater would add about 200 calls to this matrix as well. So what are some options that we could do? What we're looking to do is provide a single paramedic, supplies, and an ambulance to Acme Township and Whitewater for 24 hours a day, 7 days a week, 365 days a year. What we would utilize is Metro Fire as a driver / partner. So Metro would staff up a firefighter EMT, and that would be the partner. There would be some slight increased cost to this one because we would be adding half of a full-time partner or provider to the East Bay rotation. So they would work 124 in Station 8 and then 124-hour shift at Station 9. And then,
At
Yes.
Station 8, so they'd be at Acme for 24 hours? And then 16, is that what you said?
no, they would do 24 hours. So their rotation, because our full-time employees work 48 hours a week. So one shift would be at Station 8 and the other shift would be at
Okay,
Station
so 24, 24.
Yep,
Thank you.
yep. And then the benefit to, I should have put this on the other side, but the benefit to this is that other truck could cover the north part of our township. Right now, we don't have a terrible time with our response times up there, but sometimes that could be quicker for them to respond on that 31 north corridor. So here's kind of like our, a scheduling option that we could do. So nothing would change other than the adding of the half of a full-time person. It's hard to see on that screen. And then everything else would be covered. There'd be 3.5 full-time people in Acme, or where we place that truck, and then not much would change on ours, and then the other partner would be Metro Fire. The second option we have is to staff a full truck. So it would be, that second truck would be staffed with a East Bay paramedic and a East Bay EMT or higher person, much like we staff our current truck now. I think with this one, we could end up with some staffing issues, because if we hire more than 4 people full-time, we're going to end up shortening our part-time roster, which we can bring in more people. However, part-time people are starting to be a issue with wanting to work shifts. Typically, most part-time people have full-time jobs elsewhere, and sometimes they'd rather work for the overtime wage than they would like to come for a straight-time wage with us. We see a lot of that in the summertime, not so much in the wintertime. We're pretty good in the wintertime, but summertime it kind of shortens up for us. And I think if we were to steal from ourselves to hire full-time paramedics, which we typically might do, we might end up with some issues. So with that, we added another full-time person to the full rotation of East Bay truck on this one. So it cut down a little bit on our part-time stuff, but replace it with a full-time person. Beth, this one's.
Oh, okay. Well, and then we'll skip into this. And I'm going to go over the financials. Nick and I have both been over these in detail equally. So Nick, you feel free to pipe in, and we'll kind of take a peek. I wanted to kind of show you how we got through this and look at a couple ways of comparison, particularly with a couple of the questions that were asked. So I remember, I think it was Glenn asking, you know, how does the plan, the financials that you're talking about resonate with our current revenue and expenditure sheet? So I'm going to talk with you about how we came up with the numbers. So really, when Nick and I first started looking at this, we really built from the bottom up, almost like zero-based budgeting. You know, what would we need? We're starting with nothing. What would we need to have this organization function under these two different models? And so in doing that, we said, okay, where are we at now with East Bay, or what would we do with just East Bay? And that is really the basis of planning that you see on that far right side, where we came up with the operating cost of about $755,200. I'll talk with you a little bit about the capital outlay in just a second, but I want to focus right now on that operating cost. So once we looked at that basis of planning, we said, okay, we're looking at about $755,200 for an operating cost. How does that resonate with or look for 2021 budget compared to our revenues expenditures? And you can see right there we're at $694,225. I think I'm $1,000 off, forgive me. I think I forgot one marginal line item in there that was a charge that we don't typically have anymore. So So you'll see that number and right off of our revenue expenditures and that 994, 225 or 995, 225 with the 1,000 that I mentioned. So with that, we're budgeted to spend $694,225 in operating costs. What does that look like? How we're tracking to date 7 months through the year. So if we go through all of our line items and look at what we're expected to spend, we're at 675, 645. So we're not doing too bad from a budgeting standpoint for fiscal year 2021. We then have taken that 2021 budget and then added 5% to it because we're looking at this thinking, if we get some of this pulled together and we go to do this, we're really going to be on top of 2022, which of course we typically add some COLA indexes in there for that. So we took a look at the 2021 budget, added the 5%, knowing that we're tracking pretty close to our original budget, and that brings us to the 728, it's about 730,000, which is really quite close to that basis of planning that we mentioned at the 755. Not only close, but it definitely has a small cushion in there as well. So we felt pretty good about the numbers that we were working with. It says add capital outlay, and you can see this year under the 2021 budget, we have 300,000 in there because that's what the budget says, 300,000. So 240 of that was for the ambulance and 60 was to put away to just capture as in revenues over expenditures. And so really what we're looking at in that tracking at 220 is because we're looking at 220, that's what the ambulance will come in at right now. So that should be that capital outlay expense on that line item. Now, in the budget, going forward for the planning purposes of adding the 5% in the planning column as well, we have 75,000 in there, and that's because when we went and took a look at the capital plan and divided out what should we be adding then on an annual basis, that would be more what we're looking at. So we wouldn't necessarily plan on like if someone said, our budget right now says we're going to spend 994,000, so wouldn't that be what we would cover above and beyond? That's our budget for this year, but typically we would not have that high because we have that fluctuation with the capital expenditure. As you can see, it follows through to the commitments on East Bay. This is really what is not covered by that revenue source of the runs. The runs are a significant portion, but not the majority of the portion. Of course, as you guys know, we have two primary funding sources, and that's our tax base and our run revenue. You can see our run revenue, we're at 220 for the budget, which we thought was pretty good number. We did come in just over 220 last year. We are tracking a little bit low, and that could be from a multitude of factors, some of which we have no control over, like what percentage of our cases are Medicare, Medicaid versus regular insurance. Could be a whole bunch of different hosts of things. Could be some impact from COVID, but Nick is taking a look into that, and we're really less concerned about that right now because it's a small fluctuation in a revenue source that we might not even have control over, but we're looking at what that variation could be. We felt pretty good at coming in a little over 220 last year of looking at that 230 with the adjustment in the third column, but we brought it back down, and we had previously used the 220,000 from the budget in looking for a planning number. So that's where we came up with the 610, 200 that you have seen before. And it goes over at the bottom. Of course, we have 5 full-time personnel, 2 ambulances, one of which is a backup, and we have 1 station. So this kind of tells you, this is what it's trying to show you here is how our planning numbers do have a basis in the budget. Even though we started with 0 base, then we came back and reconciled those with our actual revenue and expenditures. The second page goes over the different options that that Nick just went over. Of course, the two variables are the staffing plan, whether or not that includes a Metro driver or all East Bay personnel, and then the number of townships that are included. As Nick mentioned, we know that Acme has been interested. Their township board has talked about it. But recently, the Metro supervisor, I'm sorry, not Metro, Whitewater supervisor and clerk attended a meeting that Doug White had organized, and they expressed a desire to have a proposal as well through this process. So we've included that option in here too, to see what that looked like. So with this, each column is a different option with the different jurisdictions included. So we have the first one with the Metro driver, East Bay and Acme. And as you can see, we come up with, these are the costs based off of that cost basis that I was showing you. Gives you the operating costs, a capital outlay that was standard amount that we have in every year to cover everything. And Nick will cover that capital expenditure pacing. And then you get a total cost. We offset that by the revenues. As you can see, it's at 320 instead of 220 because we estimate with Acme's run volume that we'll be at 100,000. And
Where are you getting the 320 revenue from?
so that's 220 is ours, and then the extra 100,000 is the run revenue from the additional runs in Acme Township.
Okay, run that by me again.
Sure. So we have 220 in run revenue in East Bay Township. So of those runs that when we transport and we bill Medicaid, Medicare, private insurance, or someone who's not a resident, that we bring in about $220,000. So the same thing, if we were in another jurisdiction and servicing that by contract, we would then bill their their residents as well. So it's those additional runs. I think there were 400 runs for Acme.
Just under 400.
And those 400 that's calls, not runs. So remember, it's got to be a transport before we're billing. So it would be that portion of the Acme runs that are transports and the revenue from those. Does that make sense?
Well, I'm still trying to figure out, when you go Acme, East Bay, you're looking at $329,800 more for personnel than, I'm just trying to figure out where we're getting that from.
Where are you you're on the,
Between option one and option two.
right.
Personnel,
Yep.
you're $329,800 more with option two.
Sure, and that's because you're not using that East Bay ambulance driver. So you're not using the Metro driver. That Metro driver is one person in the truck, 24 hours a day, 7 days a week, 365 days a year. So that one person, to fill that entire slot through an entire year, is really 3 people. It takes 3 full-timers to fill that slot. So
Metro pays that. Or they agreed to pay it?
So right now, the current situation is that Acme Township pays for 18 hours a day, correct? 16 hours a day? Okay. So Acme Township pays Metro for 16 hours a day. For the other 8 hours a day, Metro provides that. That relationship will be changing with whatever provider is, however Acme Township provides emergency services. Would that be correct to say? So either, let's just say, in whatever shape or form Acme continues to use a Metro driver, they'll end up going from that 16 hours a day to the 24 hours a day in paying that. So the difference between those is that one seat in the truck. With the Metro driver, that one seat in the truck in that north vehicle is taken up by a Metro driver. With the second option, it's not, and we've got to fill it.
Okay, and that's where, I guess I'm trying to figure out, does it cost $329,800 for one driver?
So,
Go ahead. Yep.
so that's 3 full-time people and the part-time hours to cover that. 24 hours a shift, 24 hours a day, every day of the year would be one. It's gonna take us 3 people, 3 full-time employees. Which a
Okay.
full-time employee is
So if
87.
you take 3 times 365, you've got 1,095 hours to cover.
Correct. So that's, like I said, we're gonna have 3 full-time people with their vacation, with their personal time, and then you're gonna have vacation time, personal time to cover, and then the part-time hours that are built into that will be covered by part-time people. So that's where that 3,
Okay, and who pays for all of that?
So.
With this thing we're talking about, this setup, who's gonna pay for the,
Well, let me finish getting through the financials for it, okay? All right, so you go back to, the different options are shown. You see the difference in the operating costs, the capital expenditures there, and then we show the revenues. Those revenues, again, include Acme Township's revenue involved with that, and then, of course, the expenditures for either of those systems, leaves a net cost. And then what we've done is we have divided that in recognition of the costs that go into providing the service, as well as the taxable value, similar to a ratio, basically what ratio are we of the taxable value, and recognition of the cost. So hold that question still one more minute, Glenn, because let's just take a look at the Acme, East Bay, and Whitewater, the second 2 options that are on the 2 right columns. Again, those are, your expenditures with those aggregated line items, operating costs, add your capital, and then you'll notice the revenues there are about $370,000. So Whitewater has about 100, I think, transports.
yeah, it'd be somewhere in there, just over 100.
About 200 calls and about 100 and some transports. And so that extra 50,000 is the revenue that we've counted in there. And then the costs, and then again, we've distributed these costs according to an allocation of recognition of costs and the recognition of a taxable ratio. If you go to the next page, Glenn, that'll really.
Up to this page, I still got another question on it.
Well, hold on 1 second. I want to address that one question. So let me get through here, and then we can, because some of this may or may not answer some of those questions. So on this page, this is a lot of numbers, but what I really tried to highlight for you here is what is the incremental change in cost, okay? So you have, for a comparison, that far left column of numbers, that's the East Bay ambulance, that's that basis of planning number, if that's just provision of our services. Then under option 1, what that highlighted 409,300 shows you is that's the increase in cost in going from East Bay ambulance to option 1, so $409,300. Now, once you look at the commitment for East Bay, that means that we're increasing our cost there $38,199. So you might say, why would we increase our cost $38,199? To which Nick would reply, I'll let you chime in
We're
here.
gonna add half of a full-time staff member, and then they could end up covering some of our north part of the township with call volume.
Okay. Thank you. And then we move on to option 2, same thing. That $1,350,300 is $740,100 over the $610,200. So if you went from our basis of East Bay to the option number 2 with Acme, we'd be increasing at $740,000. Now for that, we would be increasing about $95,000. And to which Nick would say, why are we validating 95,000, Nick?
Same reason, we're gonna add a full-time staff member to our East Bay rotation.
And so one of the things I want you to remember too is when we do add a full-time staff person, it costs us just about $88,000 a year. So every full-time person is about $88,000. Now the last,
Benefits, payroll tax.
You bet.
hourly wage.
cell phones, everything, yep. Then the last two show you the options with Whitewater. Whitewater is an interesting scenario because Whitewater, it financially benefits us for them to be involved. It benefits Acme for them to be involved. And in my opinion, it benefits Whitewater too. I can understand why they asked. That's a difference for the first option of about $360,000, for which our costs actually go down, and that's because we're getting larger and sharing some of those costs and spreading them out. However, they still have the full coverage that they have. They have as good or better coverage than they have right now, and their current contract's at about $300,000. And then the last option as well, you can see that same information there, the 690, and then saving to 59,000. Again, I've only highlighted the change in costs compared to the East Bay ambulance, not between options, but from the original base of East Bay ambulance. From that, I will let you head to the capital outlay plan, then we'll get back to your questions, okay?
So we've developed this capital outlay plan. Very well on that screen.
I can't see it on my paper either. Your arms aren't long enough there.
You want those glasses?
So you gotta look real close.
I'll hold it over here.
So basically, we've developed the plan that would show when we're going to replace our trucks, when we're going to replace our cardiac monitors, when we're going to replace our cots, our Lucas devices, our stair chairs. And that's where we came up with that $150,000, is just to create a little bit of a buffer and then be able to purchase the capital outlay as it comes available. We replace our trucks every 10 to 12 years. Our monitors are replaced every 8 to 10 years. And then our Lucas devices should be replaced every 7 to 10 years. And then we'll replace stair chairs and cots and power loads as we replace ambulances. So what our recommendation, as the supervisor and myself, we recommend the option 1 contract with Acme and Whitewater Townships with the Metro driver. The emergency services and fire services will benefit with this contractual relationship because we're going to maintain having that additional firefighter in East Bay and Acme Townships. And then we'll have a second ambulance available to respond into our township as well as us responding to their township, creating that robust EMS system. And as a contract for service, Acme and Whitewater Townships will receive coverage for 911 calls in their township under the direction of myself and you guys as our board. And now I think you want to do
Yep,
questions?
just to clarify and reinforce, we are looking at this as a contract for services. This is not an authority, this is not another board that manages the entity. This is a contract for services. So with that, first I want to thank Nick for all of the research in doing this, going through all the contracts, going through all the numbers, putting everything together. So really, it's a very nice job. And with that, then we'll open it up for questions and comments and so forth.
Okay. I guess one of the other questions I have, when I look at your financial, status quo, East Bay Ambulance, you got 5 full-time personnel. If we join forces with Acme, we go up to 12 personnel. That's 7 more full-time people. Why do we want to do that? 7 full-time people, that's more than double what we got right now, and we're running a lot smaller area than East Bay with Acme.
True.
Okay, but why?
Because we may run into a problem where we might have to add full-time people to, if we don't do this, we might have to add full-time staff to cover our calls that we're missing now.
You might have to.
There's a high
What we're
potential.
saying is we got 5 full-time people on our ambulance in East Bay.
Correct.
You're coming to us and want us to accept a contract with Acme, and we're gonna have 7 more full-time people.
Our recommendation is to do the 9, to add the 4 more.
I'm just reading what's here.
Right, and that's what I'm saying, is we gave you all those options, but like I said, our recommendation, Beth and myself, is to go with the option one with the Metro driver. That would hire 4 additional full-time people, would give us an extra half, that would put 3.5 full-time people in Acme Township, and that staffs that truck.
So
One of the
Metro's
things-
agreed to pay for 4 full-time people?
No. The numbers in here of the costs that go to all of the townships, that includes, so for example, Acme's contract includes the 240,000.
All I'm looking at is the numbers you have. It goes up 7 full-time people if you take Acme. And my question is, why would we want to consider that? Is
You're-
Acme going to pay for 7 full-time people?
So you're not going up 7 full-time people with Acme necessarily. You're either going up by 4
Okay,
or
so
by
these-
7.
these
So there's
numbers
two.
aren't correct then.
No, those numbers are correct. Hold on a second. Stop. Just listen for a second.
Well, I've had to
So-
stop, so I thought maybe I could keep going.
So, with doing the Metro driver, we're adding 4 people. And that's and remember, we're going to be using half of one of those people in East Bay. So that leaves 3.5 people for that one spot in Acme. And remember then, the Metro driver is the other spots for that. Now, yes, that costs $240,000 roughly for the contract for that. But that is embedded in your costs which show right next to there, that Acme has 611,000 for the commitment. 240,000 is embedded there.
Okay, but you're saying that's the cost, 200 and some thousand, and the cost difference on the other financial sheet between option 1 and 2 is $329,800 more.
On this.
I'm trying to get my arms around this thing so I understand, because my biggest concern is that East Bay Township isn't subsidizing doing other townships. I mean, we started out talking Acme, and now we come to this meeting and we're talking about Whitewater.
Well, Whitewater formally sent a letter to me asking for a proposal. So I am bringing that to you. I would be defunct if I did anything different than let you know that. I can't just say, nope, we're not interested. I mean, it's my responsibility to bring that to you as a total package, particularly when it shows that we're benefiting from a larger partnership in that region. Now, you were saying the number of staff is showing to 12, which is an additional 7, if all the personnel are East Bay Ambulance. And that's because we have to cover both spots, the driver in both seats on that north vehicle. Plus, the other issue is because we're having to hire for both of those seats, we are concerned that we're going to be taking from our part-time staff and not have enough part-timers. And so then, if you're short on part-timers, then you have to adjunct that with full-time. We've seen that at Metro before.
So
And
we're
that's
cutting
why
our-
we're not.
We're cutting our own throat by doing this, because then we're gonna have the expense of hiring more full-time because we don't have part-time.
No, we are showing you this option because you asked for it. We don't recommend that option.
And with the Metro's already staffing that driver out there right now. They already have it staffed. And then there's an increase in that contract between Acme and Metro that would fix the rest of the issue that the Metro board had with subsidizing that firefighter out of the Metro board budget.
Did you say some numbers didn't match here? Because I'm looking at them and looks to me like they do match. They're showing 1,027,000 in personnel on the first page to 1,356,800. And I'm showing the right amount on the second page too.
You had mentioned a minute ago that it costs, approximately $88,000 to bring somebody else full-time. Are we just talking about an EMT?
That's
Paramedic.
Okay,
That's our
so
average paramedic.
is there additional salary associated with the personnel line item that's skewing the number? Because I'm not getting,
Some of that is part-time staff.
Okay.
Because our full-time staff has vacation time, they have personal time, and that's the hours that would cover by the part-time staff. And there's also, in that option two, there's part-time staff added to this Acme Whitewater stuff to cover that as well.
So when we estimate the full-time, we choose a salary, we look at the salaries and we come up with a salary that's representative of the average of what we would expect to see. So we're at $21 an hour, and then we build everything off of that based on expenditures that we know, that include all the things that Sue mentioned, healthcare,
There's a full
payroll.
rate for somebody to be on.
Exactly. Well, then we do the same thing with part-time. So we take a look at what would we expect to pay for that part-timer, and we're at a rate of $17.50 that we build in. Then what we do is we take, and these were on some very cumbersome sheets, I think 2 meetings ago to show you, but basically we take number of stations, number of ambulances, really it comes down to how many hours per year we have to cover. So for example, with the Metro driver and the 3 townships, even the two townships, we have to cover 26,280 hours per year to cover. Now, a full-timer will cover at 48 hours a week, 2496. We have to back out vacation at an average of 3 weeks for 144, back out 48 hours of personal time. And then we take that 2,300 hours, then we know how many of those full-timers that we have that takes the block of that 26,280 to cover out. So then we come down to what we have to cover with part-time. So of that 26,280, we're at 19,020 hours covered by full-timers with that number of full-time. This is with the 9 full-time. Now, I will say, those hours are in the seat paramedics, drivers, EMTs that are giving care. We also have built into that then NIC's cost, because we target NIC to do 12 to 24 hours as a paramedic, and then the rest of his time as director. And those, of course, blur lines. So, but we end up having 7,000, just over 7,000. 7,260 to cover by part-time. So then we take those hours and we apply those rates, and we get our full-time, our part-time, and our overtime. So our overtime, part of it's known automatically. You have a full-timer that's 48 hours a week, 8 hours of that is full-time, because we're not covered under the same laws that the fire department are, which are, what are you guys, 56 hours a week until they pull full-time. We're at 40 hours a week. So we know that every full-timer has, their salary really is 40 hours at regular and 8 at overtime. And then for the remaining overtime, because you will sometimes get some part-timers who pull some extra long weeks or something like that. So occasionally you'll have the part-timer. We take that amount out of a budget and we study that over the past couple years. Now, we only have about 2 years to really pull that, but we see what ratio that is compared to the staffing. So then we apply that ratio to come up with an estimate of the overtime for the part-time.
Okay.
So it's built up of all of those components.
Okay. As the plan for, I think we talked about this in one of the previous meetings, but is the plan for Nick to sort of step into more of a full-time director role and have somebody backfill him, or are you going to continue
So
part-time?
we see him still as the director that he is now. We still see him probably pulling some shifts as a paramedic. However, we anticipate with that, we will be able to, number one, Nick is our stopgap right now, okay? So if there's something and it's not getting filled, it's not going to not get filled.
Right.
And so Nick will fill that. So that depends on whether he's 12 hours to 36 hours or whatever. And we feel like this staffing plan will help that too, because we'll minimize that, his time in the seat. It won't eliminate it, but it will definitely take more pressure off of those unfilled slots.
Do you want to be out of the
Not completely. That's why the potential is still there that I can work the truck if I need to.
I think I have found there's some DNA in,
Well, that's why I was asking, is how
Well,
much,
and I don't think we want a director to be out of the seat completely, because then they lose touch with what's going on and what, the rest of the staff is feeling and experiencing.
Matt?
Just, I got another question, but just, when you're figuring this out, do you figure yourself as 50% East Bay and 50% Acme, let's say?
I don't think with the call volume, it'll be 50/50 at all.
Well, but see, I look at it differently because just like you come here a few months ago and talked about the striker contract, right? Well, that would be both trucks. So the time you're spending on that should be billed both ways. So I really think it's closer to 50/50 and it should be figured that way. But that's just
We don't,
picking up on this conversation.
we don't really differentiate because Nick honestly makes very close to the same rate as some of our full-time paramedics. And so it's not, the way that Nick's position is differentiated when we're figuring out those hours is in how many hours we count him in the seat hours. So but his total cost is built in there. But we use him for, like we said, I think we've said in here, we estimate him 12 hours a week as a medic and the rest for medical director. We don't necessarily break out each employee per cost. So we do a total cost and then we've spread that by a calculation.
Okay, whatever. My other question is, Pat, if you don't mind answering this. Since we talk about Metro driver in the seat, is it my understanding right now with the situation you got in Acme, is if the ambulance goes out, does the fire truck go out too, or just the ambulance?
You can come on up here, Pat, if you like.
Yes, not a fire truck, but a squad, like a pickup truck would go out.
So all three employees
Yes.
go out someplace?
Right, correct.
Right.
Yeah.
So I guess the question I have is, since we start talking this Whitewater, which I'm not in favor, but are you comfortable with the idea that your two firefighters that are supposed to be in Acme, serving Acme, are being shipped all the way out to Baggs Road in Whitewater Township?
Yeah, our fire truck isn't following them into Whitewater. We're staying in.
But the personnel is.
Well, the one firefighter is, yeah. But again, it's one call every 2.5 days. We're not,
Well, they're being paid not through Metro and not through,
by Acme Township's paying us directly for that person on that ambulance. But, and Nick and I haven't talked about that, but I don't plan on chasing your rig into Whitewater Township.
Well, that's my question, since that's been added.
Yeah, 'cause
That's
that way it'd leave nobody in that.
Acme, right.
I guess if it was, Whitewater has people on duty as well, so if Nick needs help in Whitewater for a lift, or, again, we're gonna go there anyway if it was a car accident or something major, and we do mutual aid with Whitewater right now, but no, my thought is the one firefighter stays in Acme.
Okay.
Yeah.
Okay, that was,
They run about 200 calls a year, about 210, and then about 50% of those are to the casino.
where we benefit from the flexibility of having that additional firefighter is really just in Acme and in East Bay Township.
yeah, I understand, but we've, 12:10, I got this today talking about Whitewater being joined, so I'm trying to catch up here.
Was mentioned last meeting. Whitewater was at the last
It
meeting.
wasn't mentioned by name.
Let's
yet.
not go down that road right now, all right? No, I lost my train of thought. It has nothing to do with Metro out there. Let's move on, I'll figure it out in a minute.
And the Station 8 boundaries come into East Bay, like Station 8 covers all of Holiday Hills. They cover all the strip down to 4 Mile Road, so, you know, that Metro driver is helping out East Bay Township as well. It isn't stuck in Acton Township as well.
I know my question. Does Whitewater right now currently have ambulance service of any kind?
Yeah, they have a contract with MMR right now.
So what their proposal is, if we do all 3 townships, is to go in from 3 trucks possibly to down to 2. Okay.
And I think even if we were not to do this and Acme and Whitewater were to sign a further agreement with MMR, they would go down to 1 truck anyway as well.
I don't mean to sound crass, but I mean, that's not our problem.
Right, and that's why our proposal is the way it is we're not proposing to add 2 more trucks. We're
Yeah.
proposing to add 1 truck to cover those 2 townships, which is what MMR's plan from the beginning was.
Because I honestly think, where I sit on this is that maybe Whitewater and Acme need to do a lot more discussion on starting their own authority, or own service. You know, there's only a few townships in this county that don't have their own ambulance services, other than some of the real small ones. I mean, you got Long Lake, Green Lake, Blair, Fife Lake. Fife Lake's got problems, I understand that.
Well, they have a contract with Calcasieu.
Yeah, but Paradise, they all have, and they've all bit off that apple and gone ahead and done what they needed to do for the people of this community, just like we have. So again, I don't want to, but this is a decision that's, it's tough. It's pretty personal for me. But I struggle, the other thing I struggle with too is that even though you say it's just going to be a simple contract, you're going to be dealing with 4 different entities, 4 different boards at some point. They may not be making day-to-day operation decisions, but if we decide to raise the contract for a reason and they decide not to go that way, then we have all that investment there that's moved out. The other question I guess I have, and again, maybe Pat can answer this a little too, is didn't we years ago have a kind of an on-call situation where if the ambulance went out, somebody was on call to go back up and cover with the other ambulance?
Yeah, there was, probably even 3 years ago. The issue is our staffing's changed, our staffing model's changed. People don't really want to do on-call much anymore. And honestly, the people that work for us don't all live in the township. So I think to do an on-call type of a system would be very difficult, and we would have to pay them to be at the station anyway because they just don't want to be on call for $2 an hour or $50 a day. I mean, that's an option we can look at, but I'll tell you right now, it's going to be very difficult for us to try to achieve that.
Right. It just is that, you know, we're back to covering for our people.
And I think with this, for covering our people, this does give us a benefit because right now, if we get a call into Garfield Township, we don't have anything else. And with this option, we could have the potential to have that ambulance in Acme that can respond to our township and give the same
Yeah, but you're,
consistent care.
and I realize it's probably a truthful assumption, but you're assuming that the ambulance that's sitting there now wouldn't be there. But ours would be. So it wouldn't be a call situation, it'd be a failure of duty on MMR's part. I guess that's it for now. I've got other things I'm thinking about, though.
I've got just, I guess, one concern on the financial piece. There's, looking at the financial baseline you've
Yeah.
got for the current budget, and I know it's a small portion of the budget, but the runs, it looks like it's currently tracking 10% lower.
The 220 versus the
Yeah,
200,
For
yeah.
us, so I guess if we're going under contract to the other townships, although they're, you know, I guess their budgeted run rate revenue would be significantly lower than ours, and we run into a situation where each one of theirs was lower for a year, we would sort of hold that risk, right?
Well, I mean, we would capture their runs for the positive or for the negative. It would run just like through the organization.
Right.
That is something, though, that can be negotiated through contract terms as well for some minimum run revenue amount, too. So, yeah.
Okay. And what's the, I don't know, there's been discussions about the minimum contract commitment. I mean, is this an annual thing, or is this like signing up for 5 years?
Yeah,
What
so
is it?
typically, I think Pat has probably seen a lot more of these types of contracts than us, but typically what we'll see is, we see like just an annual contract, and,
A lot of the ones I've seen lately are 5-year commitments.
okay. Well, also, usually they have some out clause to them on both sides.
Okay.
Can we, without a note clause, can we sign an extended contract that's longer than our term in office?
Yes, you can.
I thought that you couldn't.
You can, just like when we bought pictometry, for example, that's longer than our office, and we pay on that every year. You can. Now, can
Okay.
another board make a different decision and use the out clause? Yeah, absolutely.
There's a baseline on the financial piece. Has there been any, I don't know, thought put into the baseline from a performance standpoint? You know, I guess sitting down and looking at how East Bay Ambulance has historically performed over the past few years, and what is the baseline? And
So baseline for performance is typically a response time analysis.
Right.
And then what we do, we have a patient care satisfaction form that we send out, or survey that we send out to every patient we transport. The current contract with MMR and Acme Township doesn't really have any of those. The contract with Whitewater and MMR does have a response time analysis, and their response time requirement is 12 minutes and 59 seconds within 80% of the time for response time.
And you've been analyzing that.
We've been analyzing that pretty heavily on our side to try to figure out if we can meet that contract to maintain that, and I think it's pretty doable.
yeah, I get just, you know, thinking that if, obviously I'm the, sort of the newcomer here to the township, versus a lot of people have been around here for a while, and this has been in place for 30 years, sounds like it's, you know, first-in-class services, and people don't want to see that diluted, or, you know.
And I think it actually might help us a little bit. But, you know, our average response time's now about 7 minutes and 25 seconds. And it might increase that a little bit, or lower that a little bit in certain areas if we need to. And I will say, when we get mutual aid from other agencies, I do get some concerns if we go back to the same patient often. They're like, oh, I'm so glad you're here in your blue ambulance instead of the white ambulance that was here. And that's, like, that happens about 70 times a year, if not more, and it's only gonna increase.
Right. And then, looking here, the option that you're recommending, just so I'm clear, we're back to, East Bay, Acme, and Whitewater with all East Bay personnel? Was that the right one with 12, or was it with the 7?
We're looking at this.
9.
7
7, okay.
or 9, right, yeah.
Option 1.
Oh, yeah, I got you. So you've got 3 ambulances, 2 stations. Without, you know, looking at a map here, I mean, Whitewater Township is kind of pushes it logistically out a little bit further. Are you still going to be comfortable covering that kind of area with?
Yeah, a majority of the calls in Whitewater Township and Acme Township actually center right around, like, the middle point for all the calls out of Acme and Whitewater is actually like Myers.
Okay.
So, no, I don't think, sometimes it might be a reach.
Yeah.
However, I don't think it's gonna be a major concern. And like I said, 50% of their calls are to the casino, statistically.
The parking lot is Acme Township.
The parking lot at the casino is?
Yeah.
About split zoning.
Yeah.
There's, not, this is much additional information, but just to show you the jurisdictional outlines, I was even surprised, and I look at this stuff, I didn't realize it, how far south Whitewater Township does go. I was thinking it went maybe about 3/4 of that way down.
And then just another clarification, because I'm gonna, wanted to spend some time looking at this later, maybe in a spreadsheet if I can, but, this is the actual budget, right? And you've taken these and sort of combined
Yep,
some of the different categories into something that's just more presentable?
exactly. And I can give you the line items that are on here. I think the only line item that wasn't on there was the ALS intercept fees, because we don't really have those anymore. That was something that was historical.
Okay.
But for example, all of the, let me go to that sheet, hold on. I think we have it just broken out into personnel. So personnel would cover your full-time, part-time, overtime, plus all that benefits package, the payroll expenses, the pension, medical, and so forth.
Yeah, it's probably pretty self-explanatory, but.
Yeah.
Dig into it. I was looking here, did I miss it on one of the slides? Do you have something that presents what would be the estimated runs based on what we have here versus the other two townships?
So I think the runs are just in the context, in the text in the beginning, which notes that it's about 400 calls for Garfield.
Just
I'm
under
sorry.
400 for Acme Township.
Acme.
And then it's just over 200 for Whitewater Township. And we ran just under 1,000 last year.
Okay, how many do we transport in each one?
We transport 536 when we run.
Is that on our sheet?
That's on the sheet you got before, two meetings ago.
Okay, hold on a minute. I
Sure.
want to write all this. East Bay, you had how many calls last year?
So East Bay Township, we ran 919 calls, and we transported 536.
Okay, and Acme?
Acme, they had 381 runs, and then they transported 247.
200 and what?
47.
Okay, and Whitewater?
Do you have that one in front of you, Ben?
Whitewater is 201 runs and 120 transports.
And 100 and what?
20.
200 and, repeat those.
201 runs and 120 transports.
No, I don't know if you got this or not. But of the East Bay, what did we bill for the 536 transport and how much did we receive?
I don't have that right in front of me.
And Acme,
I
you wouldn't
can't-
have either.
I won't have that, and I can guarantee you Northlight nor MMR will want to share that data. I will tell you about 65 to 70% of our runs are paid for by government insurance. And we make about $150 to about $400 per those runs. So we may send them a $2,000 bill and we're going to get $500, maybe, if we're lucky.
So I think on those runs, on those transports, we estimated it was at 410.
Yeah, our average is about 410 what we get per run. Yes, ma'am.
Now, do you get paid for all 536?
No, we don't.
And what percentage is,
I don't know that off the top of my head, but we do send some to collections. We do have a lot of write-offs that go to, because of our residents. And then we do have some that go to collections.
So since they're really varied, Glenn, as you can see, you might have some private insurance companies that pay a full, what,
So that's, that average, that 410 is an
Yeah.
average given to us by our building company that says, out of your runs that you build, this is our average that you're getting. So it gives us the ability to budget for that from there.
what do you bill
What do
per
you mean?
run?
So our, a typical ALS bill is a $1,500 bill, and it's $25 a mile from there. An ALS 2, which is multiple med pushes, intubation is $1,700, and then the same mileage, and then a BLS call is a $1,000 bill. So typically, we get, Tracy sees the checks, typically they're anywhere from $150 to $250 to $400. However, we do occasionally get one that's a private insurance, that's the full payment.
But again, all
And
of
that's
those
where,
taken on
that's why our
average.
rates are where they are, is so that we can offset that lower revenue. Because with Medicare, Medicaid, all of that stuff, we are not allowed, they pay us what they pay us. And that was set up back with CMS back in the day when, they said, how much does it cost you to run an ambulance call? And they gave them what it costs to run an ambulance call, but not what it costs to run an ambulance agency. And that's where we're dealt with, that was the cards we're dealt, and that's what, we're trying to deal with funding on the CMS side of stuff.
Can I just ask a question? I'm sorry.
That's okay, Mindy, go ahead.
All right, I just, real quickly, when CMS or whatever that acronyms you were using, when that was, that agreement was made, that was at a BLS service.
No,
right?
that's Congress, that's what they decide Medicaid's gonna pay every ambulance agency. They pay, every agency is the same payment for that. You can bill them whatever you wanna bill them, and they're still gonna write you a check for whatever they wanna write you a check for.
And East Bay residents are not billed for the difference because.
Correct. Well,
they-
with Medicaid and Medicare, you can't bill for the
Right,
difference.
Okay.
But when it comes to the private insurance stuff, correct, we don't bill
We
for the
write it
difference.
off.
Correct.
For our residents.
That's what I said, yeah. Sorry, Mindy, go ahead.
I don't remember what I was gonna say.
We've been down that road.
Oh, but I do have some questions written down.
Sure.
So you said earlier that 65 to 70 calls per year are handled by another agency for our residents. Are those typically handled by MMR?
I would say a big majority of them is handled by MMR, yes.
Okay, and you made the statement that MMR is unavailable. Does that mean?
We don't know their availability.
So when they call, when a caller goes into dispatch, then they drop tones, right? But for MMR, they don't share their location with 911 currently. So they send the call down to Saginaw Med Control, right?
Yeah, and then we just don't know what their availability is. And sometimes if we're covering a call into Garfield Township or into Acme Township, that means they don't have any trucks available. So we may end up with the city, we may end up with Blair Township, we may end up with Paradise covering these calls. We may get a truck from Station 12 from MMR. We just don't know their availability or if they're even available.
What's the increase in calls since into Garfield or Acme or Whitewater since MMR has taken over?
I will tell you, in all of 2019, we ran 25 calls into those areas. And then so far this year, we've done 28 just into MMR.
What was the previous year?
About, I think it's 20 to 25. I don't have that right in front of me.
That was 2019.
Yeah, it was 2019.
So that's 25 calls out of the 919?
No.
No, yes. No, because we didn't run 919 calls back then.
Well, whatever, I mean, you were talking different years, I get that it's different, but
I would say projection, we're probably going to double what we've done in the past into Garfield, Acme, and those townships in the city.
And the primary advantage of using the Metro financially is because they have their 56 hours versus the 40 hours?
No, financially, it's going to, I mean, their setup cost is a little less than ours. But it's not a financial impact for us. I think it's an overall emergency services impact. Because if this were not to happen with the Metro driver, I don't know their plan on keeping the second firefighter out at Station 8. And that eliminates the initial firefighter that would be responding into East Bay Township for a fire, or into Acme Township.
Okay, but I'm looking at the financials, and there's a pretty big difference.
And that's because,
And you stated that you're gonna go to another full-time employee at East Bay
Correct.
Ambulance. Don't we need that do we need that full-time anyway?
Will we be adding someone without doing anything, is what you're saying, right?
If you need it to,
It may be a request in the future. I don't know when that request would be. I'm currently analyzing our overtime, analyzing the amount of time I spend extra on the truck to make that decision. I don't have that answer right now.
okay, so it's more probable than not in the next 5 years, you're gonna need that one locally.
Correct.
Okay. So my next question is, what do we have for, I know that the census isn't back yet, but what is the estimated growth of East Bay, Acme, and Whitewater in the next 5 years?
I don't know what the census will show. All I can tell you is just, you've heard me talk about the research from the MDOT with 2045 that shows that we're one of the fastest growing areas actually in that Holiday area. It's not really, it's like 4 mile east and north of Hammond Road, that whole kind of quadrant there. That was one of the fastest growing areas in Grand Traverse County, according to MDOT's 2045 planning. And then I can tell you that we were the 4th largest growing county in the state of Michigan, and the first among all counties of about 100,000. Again, and not that this adds anything necessarily with the ambulance, but we anticipate the census to come back that will be MPO for transportation planning too, which is over a certain threshold. So they're expecting the numbers to show that, to show the growth sufficient for that.
I think rough numbers that I saw today showed about 11,000, just under 11,700 as our revised population. I don't know how accurate that really is because of the pandemic and people not responding. I don't know if it's worth having a mid-decade census to try to get a better key to that, because I know I'm looking at it from the election side and how to handle that growth. But
Do you happen to look at the growth of Acme or Whitewater when you were doing that?
I can get that for you. I don't have it tonight because I looked at a chart that Census Bureau brought. They sent out today. I did clip it, but I didn't bring it. But the other side of that too, Beth, you talked about 4 mile east and north. We have to take into consideration Hammond South, that we're going to be affected with the 2 major developments right at Town Line to Verndale. And then also right there on Hammond with the new development that's going in between 3 and 4 mile.
Yep.
With all of those, if you
Yep.
think even just one person in each of those proposed houses or units, you're looking at close to 1,500.
Yeah.
And likely, they're going to have more than one person in each one, and they're going to probably have, maybe 3 people.
I think it was interesting to me that they showed such a very specific region in that MDOT map, but my takeaway was it's probably a little broader than that,
And it may not be on their radar yet, because some of them are still in the process of happening.
Pat, did you have something to add to the population?
I do, and that has to be what kind of growth that do we have coming? If you look at the population north of US 10, 65% of that population, or 61% of that population is over the age of 55. And we're starting to see that here right now. I hit 60 this year, so I'm in that group, so. So I'm with you now, Glenn. But if you look at, if you saw Matt McCauley's article a couple weeks ago in the Ticker where he looked at the demographics of our area, and we are an aging population here. So where I'm going with that is the people over 55, at Metro statistics, which would be the same as East Bay's, 65% of our the EMS calls we go on are people over the age of 55. So retirees are moving in here, the development just down the road, retirees are moving in here. Lafreniere's going to have 4,000 people living just on Lafreniere and Barlow, that chunk of Garfield. And again, they're building those kind of homes, retirement homes. So the demographic that's moving into Grand Traverse County and into our townships are older people that use our services. So you gotta look at who the people are that the growth is. They're not young kids with families, unfortunately.
Nick, a couple more questions I have is that the pandemic has changed everything. But how confident are you that our ALS numbers, since what was relatively new, coming out, hopefully coming out of a pandemic, are actually the right place to be, I guess, isn't it?
And that's part of the issue, is we're dealing with data from last 2 years. We've made a lot of changes as an agency. You know, we covered the rest of our township, COVID hit, so we weren't able to get a lot of the accurate data. I will tell you, it trends kind of about the same place where it has been in the past. The only difference now is our transports are down. We're not taking as many people to the hospital. But call volume is pretty stable.
The other thing I would add to that too, if you look back at our budgeting, we have been really quite on track with our ambulance budgeting. And Nick and I were just commenting the other day on the ability that, or the capacity that we had to handle what COVID threw at us from an operational standpoint, as far as equipment, personnel, all of that, to the funding as well. We came in really closely with our line items. So we feel like we have a pretty good handle on numbers. So I'm not sure that you were asking this question, but in case you were, is how much can we count on those numbers?
Well, like Matt said, that, you know, the ambulance has been around for a long time, and, you know, it's the standard, right? It's the Cadillac of the ambulance service, in my opinion, right? But the ALS portion of it has been very recent, and I am very concerned that our standard of care, although we don't want it to, may go down. And that's what I am concerned about, is the standard of care to our residents may have a change with this. And especially with the limits of Whitewater Township, the limits of Acme Township, and then the ambulance bus. You know, we were talking about getting rid of a bus, and now we're gonna put it as backup. You know, is that really where that bus should be? I know that there's 2 buses sitting over at the former osteopathic hospital. I don't know what's
You don't
going
want
on
those
with
ones
them.
either.
What?
You don't want those ones.
I don't, that might be true, but, you know,
I don't see our standard decreasing. I think what we're going to see is we're going to continue to help and bail out Garfield Township, Whitewater, and Acme anyway, if we don't do anything. The only thing that we have is we don't have the backup. We don't have anybody to come help us if we're helping them all the time. And that's where I see an issue, and I think this is where our opportunity to capture upon that. And we can grow, we can expand our service area, and I don't see the increased calls in Acme and the increased calls in Whitewater affecting our truck now. If anything, they're going to help us.
is it possible to do a BLS in Acme with the ALS in East Bay?
Now we're tying up 2 trucks
Yeah.
for 1 call.
Because we have to do an ALS. What percentage of your calls are, I think before, when we were BLS, 60% of our calls were ALS intercepts. And so then you're tying up our ambulance in East Bay to go intercept in Acme.
To transport. Because BLS can't transport, right?
Well, they can transport, but they just can't.
They can't
do
push
cardiac
meds and
monitors.
stuff.
The other thing I wanted to mention to you is on the, you know, we've operated BLS for a long time and ALS more recently, but just so you know, the numbers that we've looked at are all built from the ground up. They are not historically generated from any BLS historical patterns from, say, over 10 years.
But my thinking is that And there was an article in something I just read that there's no paramedics, there's no EMTs.
We don't have an issue with getting paramedics and EMTs, we have an issue with open spots.
Right, so that leads me to the question, does Metro have that same issue?
You mean to fill the Metro driver?
But right now, of course, part-timers are hard to find, but we're pretty stable right now, and we are bringing in about 7 to 9 a year. So I see us being able to continue that.
We're also looking at programs within Metro, without speaking too much out of turn, it's strengthening those relationships with part-time as well.
Nick? Question, do you keep a record of the calls where somebody else comes into East Bay and the amount of time, response time there is?
I don't keep a record of the response time, but that's one thing that I can work on. It's hard for me to, I'm gonna have to track it through our dispatch center.
Well, when-
And actually, Metro might be able to help me out with that a little bit too.
Well, when you talk about other ambulances and the amount of time sometimes we wait, my concern is our taxpayers. I'm not, apparently we got problems with ambulance service in just about every township.
Correct.
You're not probably gonna like what I'm gonna say, but I'm gonna say it anyhow. When does everybody get together, because East Bay can't be the ambulance for Grand Traverse County, okay? When does ambulance directors and emergency services sit down with everybody and try to figure out something that's gonna work? This is almost like piecemeal.
I will tell you that we, as most ambulance directors and chiefs, can sit down and have those conversations. However, there's one ambulance company that will not come to the table. And I agree with you. How do we get all the one big picture? And I think this is where we can help that out and we can provide that growth.
Cost.
But at the same time, it's gonna help our residents as well.
I agree with you in one aspect, the other aspect I don't, because we're out in another township. We get a call for our residents, and they're gonna wait an extended period of time for whoever to come in here.
They're gonna wait
And-
right now.
Huh?
They're gonna wait right now.
Why are they gonna wait right now?
You're saying because if that Station 8 truck right now is gone, and we get a call in Acme Township, we don't have coverage in our township right now. Or if we go into Garfield Township for a call, we don't have coverage here. And if we're Garfield
That's what I'm
Township,
saying, though. Our taxpayers are paying for the coverage,
Correct.
and we're not gonna have it. We don't have it now because of the inadequacy in the other townships. We're going over trying to help them, and our residents that are paying for it are suffering.
because I think one thing that's gonna change is in Station 8 in Acme Township, that ambulance will be there more than it is now. Right now, that ambulance moves up to cover the city calls often. We're not gonna do that as much because City Fire can be their own mutual aid. Because now they pull that truck in from Acme to cover calls in the city consistently.
Glenn, I'm not sure I'm understanding the question as far as our ambulance, an East Bay ambulance will still be at Station 9, housed at Station 9. An additional ambulance will be housed in that Acme Whitewater area. So I'm not sure how our residents are negatively impacted by
Okay,
that.
if we got another ambulance at East Bay, okay, why do we have to bring somebody else into our area? Because we don't have anybody to run the ambulance.
Right
Correct,
now-
we don't have the staffing, we don't, we
Exactly.
don't staff up for that truck.
Exactly. That was my whole point.
This way, it would be staffed up, it would be in a different township.
It'd be-
However, there would be more available to respond into our township versus what the mutual aid is now.
Exactly. I don't disagree with you there, providing they're not on a call in Whitewater.
for the city, because he's just
Or an
said that
Acme.
they go to the city as well.
Yeah. Okay.
And our hard part is I don't have the data in the right spot to figure out how many times, where we would, if we were to put a second truck on just for East Bay, where we would staff that, how we would staff that truck, hours-wise.
Oh, I'm not saying you would put a second one on in East Bay. My whole point was that, we're going out to our neighboring townships, running a call, which means that there's nobody in East Bay Township to run our calls.
Yep.
Not under these scenarios.
Right now.
Right now.
Correct.
And they're not 100% sure it would be if we had one in Acme, because if they're running the Whitewater,
Well, sure, there's no guarantee. There's nothing in life you can do without risk, right? You can't say that on anything. But what this does is minimizes that opportunity for that to a great extent.
at a cost.
At a cost of, let's see, if we do it with Acme, about 38,000. But that cost of 38,000 is warranted because we're taking advantage of having a half of a FTE, which we may have to put on anyway. And if we do it with Acme, East Bay, and Whitewater, we're actually decreasing our cost to our residents. So we would be increasing the service capability and response to our residents and decreasing the cost. Sure. Sue?
I've been pretty quiet this evening. Kind of hard to take the minutes and be engaged, just letting you know. I've been trying to look at it as a perspective, as a resident that pays taxes and knows the history of how the ambulance came to be. And for all the years, if you call 911, you get the guys in blue, the guys and gals in blue. They come, they give you exemplary care. They're your neighbors, likely. They have your history, they know you. We've come to expect this level of service, and that's what we pay for. That's what this board is charged with, making sure we do our due diligence to keep up that. Right now, I can't think of our borders, our neighbors. I have to think of what our voters have put us here to do. I understand, and I would wholeheartedly say, yes, you go across the borders, you take care of the neighbors when there's a call and there's no response. But I'm concerned that the growth of trying to cover 2 more local jurisdictions will impact our borders within us. The care level may not be there because we're stretched too thin. I don't want to see that happen. I don't want that legacy for future boards to deal with. I don't want that to be an issue. That said, if this is going to happen, I do see it as an East Bay ambulance system. I see it as all the East Bay employees that could be at any place, but this board controls their employment. This board pays their benefits. This board is all of that. We come up with an idea to contract if we choose to. We don't have the complications of other entities, no matter who they are, because it may not be our trusted fire department at some time. It may be another entity that comes in that those other jurisdictions say, hey, we want them to do the driving. Let me go back to where I was coming from. Right now, the quality of the care of the driver, I think through background checks, everything else, we should do that. That's on us. That's where our liability is because they're our employees. When they're not our employees, I don't know how that liability goes. I think maybe last month's meeting, things got a little bit murky and maybe too many weeds. This isn't anything more than what East Bay Township Board and Medical Director want to see happen. The other authorities, the other entities get to listen, but they don't get to make that decision with us. This is our decision to make, nobody else's. If we choose to do that, we present a package. They see what that package is. If it's all East Bay employees, that's the package. They go with that or they don't go with that. Maybe that will encourage them to have a communication between the two local jurisdictions that are asking for help to come up with their own service, maybe. But truly, in my opinion, I'm struggling putting a blue box anywhere else but East Bay Township. I don't want to overextend our caregivers, and I don't want the disruption in the service that way. Maybe, like others have said, maybe it's time for a second ambulance that is staffed. Or we staff one more person, two more people. I still go back to 9 runs 24/7, 365. But if we're not there, maybe we're not providing enough coverage. Maybe we do need to have 7 full-time. And they're still all working 48s. I don't know. I don't know what those numbers look like. But if we're trying to have 2 rigs so that we can have coverage when somebody else is out, maybe those 2 rigs need to be East Bay rigs in East Bay. I don't know. I struggle. It is the board decision. We'll stand as a board no matter if it's unified or not. It's the majority speaks. But I am struggling of doing anything other than East Bay.
The thing is, I guess, when you start talking about the situation we're in with adjoining townships, not just I'm talking about all of them within Grand Traverse County. East Bay taxpayers is decided to pay to have good coverage. As long as we go out and run everybody else's area, maybe they don't want good coverage because apparently they're not paying for it. We need to look at it like that also, I think. You know, we're paying good money to have a good service, run good. Apparently, nobody else wants that, or they don't want to pay for it.
Or maybe they see what you're talking about, which is if you run a more regional system, that there's some efficiencies to that. Like you said, when is everybody finally going to get together and decide when, you know what you said earlier? When will that happen? But why? Because there's efficiencies there. One of the things this does is it allows us to address any shortcomings, even if they're small, and the risk is minimal, right? So we have 1 rig, and when it's tied up, then we have other mutual aid. That's a small portion of our calls, but it is a portion of our calls. And we've found that the aid is not sufficient. This allows us the ability to have that second rig without having double those costs. I mean, having a second rig in East Bay Township, solely for East Bay Township, is tremendously expensive, tremendously expensive. Again, we said it's almost about 3 people for every 1 person sitting in that truck 24 hours, 7 days a week. That's quite a bit of an expansion. This allows us to leverage that in other jurisdictions. I mean, I don't see what would diminish the service that our ambulance drivers, our paramedics, our EMTs are giving right now. What that would diminish. Our service in East Bay Township remains steady and very much as it is. We are very, very fortunate in that We have strived to do something very different in the past few years, very different. And I think we've, luckily, with the support of this board, we've succeeded. And one of the things that affords us is the ability to become an employer of choice. And we do have people who want to work for us. When other people aren't getting applications for paramedics, we're having 7, 8 qualified applicants. We're having people contact Nick when they're, seeing him bypassing in the care. When are you hiring? They are familiar with our ALS service now and under his direction and want to work for us. It would not be a difficult thing to staff those other positions. So we would have our continued care in East Bay, plus the additional redundancy and payment for that care for the other jurisdiction. So you have you have care staying the same, if not increasing. You have cost either marginally increasing, but we can validate why that is, at either a half FTE or a full FTE, or even potentially, if we're able to spread that with Whitewater, a savings with the same quality care. I mean, that's kind of the planets aligning.
Could you elaborate? You mentioned about we've been able to offer something different. What are you talking about?
Talking about advanced life support system in an ambulance with a director who values the quality of the care, who's implemented procedures, contracts to elevate the operations of the ambulance.
Which is not totally unique to East Bay.
We're the only third service in the county that provides EMS services separate from fire services.
So I guess it is unique.
Yeah, that part's unique. That's what I was getting at. You made a comment, I just wanted
Sure,
to hear what it was.
sure.
So,
One comment kind of related to, I guess, the employees. Y'all sound like y'all got a pretty tight-knit group and some pretty good tenure among a lot of the employees, been around for a while. One thing I guess I was thinking about is, I guess by default, if this is a contract service, then the employees associated with those contract would essentially be contract employees. So you always run the risk that you try to bring, good morale and good team together, and everybody's working well together, and maybe one of the townships, for whatever reason, doesn't like, changes to the pricing or increases or whatever, and that contract is then nullified, and you've got to let people go, so that could, impact team morale potentially, so just a thought.
So are you saying if we expand, we might have to contract?
Exactly, yeah.
Yeah.
Yeah, and I think, I'm not in the business, but at least in my business, typically when you're dealing with contract employees and, dealing with the potential for that change, you get, maybe some more turnover, more volatility.
And I think that's a risk when you expand your services, you're right. But, I think most of our staff, whether our full-time staff or part-time staff, is a believer in this project. They think it needs to happen for the betterment of both communities, or I should say all three communities. I think part of what drew Doug to us is we're doing well. We're doing things good. We're making impressions. We're giving a good service. I think he sees that and wants that for his same township, and at the same time, doesn't want to start from ground zero.
They don't want to pay for it.
I don't necessarily think it's a cost thing completely, but I think it's we have a good service, and why not try to adapt with us? I understand the hesitations. I get it. But I think that with us doing this and us growing, and I'll tell you, we're probably going to be in their townships anyway, covering calls. We covered a call for Acme today.
I heard all the sirens. Holy cow.
I don't know, it wasn't that one. We didn't run lights and sirens, but
Oh, man, there was lights and sirens at,
12:30?
yeah.
so, You know, it gives us an opportunity to be a friendly neighbor and to help expand our service and have our backup as our people versus somebody else in our township. And I think with, Sue, with the hesitation with the Metro driver and having the background check done
Or
through us.
anyone that isn't.
Or
East
any
Bay
other
employee.
entity.
So take the other authorities out of it, but anything that isn't East Bay employee.
You know, oftentimes we do have a Metro driver drive now. If we have a high priority call, a Metro driver's driving. We have that relationship now oftentimes. Sometimes if I go to staff a second truck, and it's just me, I might call chief and say, hey, can I have somebody drive for us? Yeah, that's what we do.
But that be an exception, not the rule.
Correct, correct.
I appreciate that. Thank you.
I kind of echo a little bit of Glenn's concerns about, this started out just a few months ago, of partnering with Acme, and then it spread to Whitewater, and I'll say it, the elephant in the room is still to the west, Garfield. As long as they're not willing to up their service, I don't know what's going to happen there. But Beth, you made a comment about efficiencies and stuff, and I get that, and I understand how that works. But I've been trying to do a little reading and a little research, so I checked out MMR. If you go to their webpage, that's what they brag about, efficiencies, and how the service they're supplying. They brag about a 90% satisfaction rate. Now, I certainly hope we've got a better than a 90%.
97.
Yeah. But with that said, and I'm not trying to compare East Bay, this situation to MMR, but by reading it, it's very similar to what MMR did. They had a group down there that needed to create a service, and they did, and so they expanded a little bit, and next year, someone else wanted service, someone else wanted service, and now they're all over the state, and look what kind of mess they're in. I'm not trying to say that's where we're headed, but I do have that concern that we're expanding way too fast. I think, personally, I think Whitewater is out just simply because it's just not logistically, I don't care if it's just a few calls. It's way out of what 9 was established to do.
But 9 wouldn't be responding that, just for clarification. They'd be responding out of 8.
But it would still be our ambulance, so however you want to make the details. I struggle with the Metro thing again, and I know people are going to be upset about that because memory doesn't go very far, and you don't have to go very far of what has happened, unfortunately, with the board. And, so I'm a bit concerned at what could happen there. And, the other question I really do have, though, Pat, have you guys thought anything? What if Acme just decides they don't want to pay for the MMR service? What would you do out there? Would you have a second firefighter? I mean, that's all part of this mix that we're talking about, so.
Well, we need a second firefighter out there. We need a firefighter out in Station 9, but you got to look at where the calls are, where the demographics are. We don't have it in the budget, so we would probably open it up to part-timers and see if we can find it until we can find an opportunity to put a full-time person out there. But the proposal we have to Doug is that we would have 3 full-time firefighters out there working at Station 8 along with the other one.
And just
We also think that because our driver's not driving MR into town and into the west side of town, then we're going to get more part-timers. Part-timers are tired of going to Acme and then not being there all day because they're they're on the west side or downtown. So we think we'll be able to attract more people to work there.
Right, right. That's, what, I don't know when the arrangement started with Acme and was Northlight then, but putting the Metro driver in place. But what happened before that? Did you have two people out at?
Way back when I started, we at East Bay used to cover Acme. And Whitewater used to come in, so, I mean, that was our area until probably about the mid-'80s, and when Grand Traverse EMS took over from the old county ambulance. But Northlight used to go out there from their station on 8th Street. They used to be in City Station number 2 with a firefighter. And then they built that station on Hastings Street, so they would come buzzing out there from Hastings Street. So probably about 7, 8 years ago, they just saw a need that the east side of the area was growing, and so Roy Mice from Northlight came to Acme and said, hey, if you can provide a driver 16 hours a day, we'll provide an ALS rig out here 16 hours a day. So that was when Acme came to us and said, hey, are you able to provide a driver? And then we got an ambulance out there 16-hour days, which was huge. And what Whitewater forgets is Northlight covered a lot of calls in Whitewater when they were having their problems too out there. So,
Yeah, it's too bad Northlight disappeared in some ways. I don't know. I'm still on board with the idea that if it's going to be our rig, it should be our personnel on board, and that includes the driver. I get that it helps out the Metro situation and having another firefighter out there, but that's also my concern. I think I'll say that, too. Acme Township residents pay a lot of taxes to have fire service, and if the situation is that, you know, it's going to be a lesser service because they don't have this agreement, that's not right either. And it's the same thing with 9, you know. 9's been kind of shuttered, and it shouldn't have been. You know, that was never the agreement from my understanding. I get it's dollars, but and that does have a little bit to do with what we're talking here, because if they were firefighters there, then we wouldn't have some of the situations we got going on. But I'm still concerned with the idea that we can just take on anything. You know, it's easy to put it on paper and talk big and say, boy, let's just do this. And I get it. You studied it for a couple months now, and I think it is probably somewhat feasible. But I'm not sure that's the charge that we've had, and that's the direction we should go. I definitely don't think we should include Whitewater. And if we decide to offer a contract to Acme, it's my opinion, it should be with all East Bay staff.
Okay, Bet, I appreciate that. I did want to just mention one thing with respect to MMR. Our consideration of supplying services to Acme and Whitewater is very different than a nonprofit model that has chosen to expand. So one of the reasons they would have chosen to expand, obviously, they have a different funding source and a different model. So they would need additional areas to pull in those revenues. We actually don't need to do that. And one of the reasons we're choosing to look at this is really to improve the reliability and the redundancy of service to our East Bay Township residents. So, and then offset some of our future, what we see as impending costs to be able to share those and get adequate coverage and share that with Acme Township. So I just want to be careful of that analogy between a nonprofit MMR model and a municipal model of the ALS service that we have right now. But I appreciate that concern.
Yeah, you know, this ambulance stuff is going on everywhere. If there's a situation in Wexford County right now, if they were to come to us and say, hey, you guys want to expand into Wexford County, I'm going to say no. We don't want anything to do with that, right? This is beneficial for both us and for Acme and potentially Whitewater. And that's the only reason that we even entertained this idea and had this discussion, is because it's going to benefit us as well.
Just today was at an event that spoke about, there was the city was there, and East Bay Township, and the county, and then some other agencies. And everyone, spoke about the appreciation for collaboration and how collaboration is what brought that project to fruition. And I see that time and time again here working at East Bay Township, and everything from, the PFAS situation, which was really the states and the state and the county and the township working hard together, to, the TART trail on Parsons was done today, and that was the county, the city, the township, Traverse City Light and Power. It was a bunch of different entities. And that collaboration is what I think makes things very strong. And we've collaborated particularly well with Acme, with water and sewer on many different fronts. And I see this as another potential for collaboration that benefits our residents and the region's residents. And as far as Whitewater is concerned, I would certainly think we would consider at least looking at anything that allows us to continue that process and allows us to, offer the distribution of costs that we're looking at potentially there. But go ahead.
Say something. I've been really quiet, but I've been talking about this since, 2 months ago when you brought it to us. Nick's probably tired of coming into my office with checks, because every time he comes in, if I'm free, I'm asking questions. But for me, we were talking even today, I would want to know that there is an ambulance or staffing to come and take care of me if I'm at Myers and have an accident, or if I'm at my home and have an accident. And, whether I can get it from MMR or whomever, I won't even put a name, from an entity or East Bay, it goes back to what I want for me and what I want for the neighbor next door. Part of that is a responsibility because we have an ambulance. I think that's, and I've never worked in that arena, emergency services, whether it's fire or ambulance. I keep hearing that's in their DNA. They're going to help regardless of where they're at. So when I look at the caliber of ambulance service that we can offer, then I know that that's in their DNA to go and offer it, whether they're sitting in East Bay or if they're going to go over the line. And we go there already. We're already stretching, and this allows us to not have to stretch as far with our caliber of service, because we'll be covering ourselves as far as backup, our own mutual aid. I do have a question on the capital outlay, because we are getting a new ambulance this year. And if we keep the new ambulance and the one we were scheduled to take out of service, does this capital outlay include putting that into your rotation of 10 to 12 years?
Yeah, so it's, the replacement in 2021 would increase the price a little bit because of the trade-in value. And we would need to buy a
Oh,
new
because
pump with
we're-
that and stuff like
okay.
that. And then we would schedule to replace that back up in 2024.
Okay.
So that backup ambulance would be replaced in 2024. And then it would rotate from there.
And part of the, I think from the last meeting, you talked about a capital buy-in, for lack of better words, of like 75,000. Is that to take care of some of that lift system that we'd have to put in, or some of that equipment we'd have to
Correct.
put in there? Okay. I mean, to me, I guess it doesn't matter to me if we, I shouldn't say that. I think we could offer a contract to East Bay, or to Acme and Whitewater, with a Metro driver or with our driver. It just makes a difference as to how many employees we have, correct? Because we would increase by one instead of half.
Correct.
For East Bay. And to me, that might make your scheduling better. But if I look at it from the Metro side, it would probably make their scheduling worse. So,
I don't know if it would make theirs worse because they're already staffing for that. They staff that 24 hours currently right now.
but wouldn't they need another person out there? Okay. Not that that's this conversation's issue, but it kind of is.
Can I just ask for clarification?
Yeah.
You're saying that fire is being staffed 24 hours a day, but ambulance is being staffed 16? Is that what you were saying?
Correct.
Thank you.
Mindy?
I remember my question for like an hour ago. This contract services line item, does that include payroll and expenses that the township has for,
That is built into the personnel, I believe.
It is.
Contract services is our,
just a billing?
it's our billing, it's our service agreements, it's the surveys, all of those, it's our scheduling
Glad you
software.
asked.
It's our,
I can't see this.
bigger font.
It's
I can.
It's our EPCR software, it's all of
just a
those
rough,
contracts.
rough
that we
draft,
hold
but it's
with
just all the contracts that we have.
To do the business.
Pass that down to this gentleman. But we looked at every contract and how it might vary based on the changes.
This one.
So the $18,000 increase from the projection of just East Bay to
Excuse me.
the East Bay and Acme and/or the, because it's the same price. Wait, that's not the right one. Yeah. Why is it $1,000 more if it's all East Bay personnel?
Because there's some contracts that are based on per employee.
Okay. Now, I'm looking at this as this year. I got that under control, but I don't have 5 years down the road under control. Because I think we're gonna need, if we're gonna continue to service 3 townships, I think we're gonna need more rigs. And I don't think that that's in the plan. I think that the growth of this community, even just looking at what is already permitted and being built, whether it's Alta Vista or the new development on Town Line, you know, the rezoning that just happened on the golf course, and all these other things that are coming at us, I think that the 2 ambulance in our township is gonna be a reality sooner than later, just because the growth of this township. And that there's also growth going on in Acme, and there's growth going on in Whitewater, so I appreciate the capital expenditures report, but I don't think it's gonna work. I think we're needing more than what's on there, with the population growth, and that's my struggle.
And that's all obviously hard to quantify for a couple reasons, right?
I get that.
Yeah. Timing of those developments, you know, infrastructure, whether that exists in Whitewater and Acme and how that impacts development. Also, what then is the taxable value, and that affects the revenue that comes in. And those are things that will drive the population, any expansion that's needed. Again, we base that on, you know, that's why we have a distribution of the costs, and it's built on tax rates, helps with that. I mean, I can't tell you, you know, that we will or we won't need a second rig in 5 years, obviously. What I can tell you is that we have pressure that would be alleviated by a half and a full-time or a full-time FTE that would alleviate that for some period of time. But, you know, as those changes come, then we plan for them. I mean, we respond to them.
I mean, the same thing would go back when I started. There were 400 and some odd homes permitted and approved for, what, Vanderlip? Was that Bergsma's property or something?
Yeah.
And that never came. I think we're at a little bit better economy, if I can say that, through a pandemic. I'm not sure. But I think we're at a little bit better place.
We're in a different housing crisis.
Yes and no. I mean, yes, but than what we were back in 2006. We had the recession of 2008, and everything kind of fell out. So, you know, we planned back then, and we're just now getting to the point where maybe we'll see those 400 homes built on a different piece of property, but.
I'll tell you what I'd be concerned with is what happens on Hammond and Lafreniere. That would be my concern as far as growth goes, because it seems like that all grows. We might have some that didn't, but I mean, it's wild up there.
Right. I don't know what they had approved over there, you know, in the same time period. But yeah, right now, they've got several developments approved over there, or working on being approved, same as we do here.
Eventually, the west side's going to be built out, and the growth's going to have to come here. We're not too sure, we're not too far.
So as you can see, we've done quite a bit of analysis on this. We've talked with the other townships to the extent that we've mentioned. Would you like to see me bring this back to the board for discussion at a regular board meeting? How would you like to move forward? Doug, do you have any hard deadlines, or what are you dealing with?
Well, one more.
And up to the mic.
You know how this works.
That was loud enough. One of our hard deadlines is going to be, as we take it back to our taxpayers and having to put a millage in for this. So we're kind of running on a little bit of a deadline. Not more, a lot.
So the deadline to put anything on a millage for November is August 10. So
Well,
realistically,
we've
unless
got,
you've got
we've
the
got,
language.
we actually have a millage already. It would be adding on, but I want to bring it before the public, not just all of a sudden they open up their
Right.
tax bill and look.
He's talking about the what is it, 4029? The one in September,
Right,
yeah?
Right, but if you need to take a voice, take it to the voice of the people, I don't know if you need
That's
to do
what I
it
want.
as a ballot proposal.
No, we won't put it on the ballot.
Okay, there's a ballot
We're going
proposal.
to bring it before the people and let them know, because, like I say, you open up your,
So you're doing like a public hearing, or
yeah, we're
some,
going to open up public hearing.
got it,
But to put it on the tax roll.
Got it.
That's got to be
Okay,
in.
I'm happy for the clarification, because all I was thinking was, if you've got to put it on a ballot, August 10th is that drop dead date
No, we can-
for
Well,
November.
look at it like Christmas, you open up your gift.
Yeah.
Your remnants
Come
of
to
the
the end of the office and that's the guy with the pitchforks.
Merry
and the
Christmas,
tongue.
right?
Yeah. They'll be tar and feather me, Glenn. But I do want to thank your board for, considering this one way or the other. I know it's a tough decision, whether you bring on or not. Glenn, to voice, we're not willing to pay for it. We are. I'm looking at it. I mean, otherwise, I wouldn't be coming and asking you. I look around at different EMFs, and East Bay stands out.
It wasn't directed at
Oh,
the two.
Oh, no,
No, it was,
And it's, and I don't take it personally. I mean, say what you want.
you're elected, right?
I'm a duck, it just rolls off my back, just like the water. But it's, East Bay has gotten a good deal for a time. And I knew after I got into the office and looking at it that it's going to come to an end. I just didn't think it'd come this quick. And with MMR, if depending on how your board goes, I don't believe we can start up an ambulance service ourselves in Acme Township. Because of the fact of the cost of the startup to get it going. I know it costs the East Bay a boatload to get it going. And there's no doubt in my mind at all. But at Acme, I don't believe we're there yet to where we can. If the tribe pitches in and helps out, they own a good share of Acme Township, as we all know. It's just having to come out and say, okay, this is what we've got to do. We've got to do what we've got to do. Unfortunately, good or bad, you got to take it off and bring it out to the people, let them know, but that's where we're at, where we're sitting on a timeline to bring it out to the people so that it can go on the tax roll and go forward. Because if it doesn't go on there, it's, I don't know where I'm gonna find it out of the budget.
Doug, when's
I'll be
your,
honest.
Doug, when's your next board meeting?
So,
When's your next board meeting?
our next board meeting is a week from today.
Okay, the 10th.
And
the 10th.
Okay. Okay.
and you have to have your public hearing in place and a decision made before September 30, so you can get that L 4029
Right.
to Jim Baker.
You don't have a rich benefactor out there to buy you an ambulance?
Maybe
Well, my rich uncle passed away and he took it with him.
You know, that's how East Bay got started, my understanding is.
Well,
They were discussing whether to do it or not, and all of a sudden, someone bought an ambulance for
we
them.
have though is,
Used.
actually was, it used to be East Bay.
Yeah,
And you guys
The
give it to
Whitewater.
us, we could just let you annex us back in.
Oh, man.
Doug, we videotape our meetings.
you gotta get Doug back to Whitewater too.
Yeah, we'll do that.
Oh, man.
Thank you, Doug, appreciate that. Well, I will tell you, we talked a little bit about the Whitewater. I don't know how strong the desire is for Whitewater to join anything like this. I mean, yes, their clerk was there and their supervisor and did ask for information. I haven't seen a tremendous amount that tells me that they're super interested, more, questioning whether it would be beneficial. But I do hear and sense an urgency and a really sincere desire to be involved in the emergency medical services from ACME and its board through hearing about their meetings. So I guess with that, I'm looking for suggestions, but I guess I would propose maybe that we do put this on our August 9th board meeting, and maybe, unless the board wants to give Nick and I any direction this evening, we could put it on our 9th board meeting, which is full of some decisions, not terribly hard ones, but, enough presentations and stuff that it will be a long meeting. And we could put it on that August 9th agenda to make any choices as well.
The only thing I see is I think there's a portion of us think one way and then a portion thinks the other way. And so what's going to happen August 9th? Are you going to come back with the same proposals and decide it then? Or are we going to have just one proposal to think about? I really think we need to decide on which way we want to go before we get too far down that road.
I hear what you're saying. I'm wondering if there are some who want to take a look at some of these numbers a little bit more in depth, and I just want to give them that ability to do that.
I guess when I look at the numbers, and I'm not an accountant, but when I set and subtract and add, they don't, just like the 7 employees that are gonna be added. Now, if we weren't gonna add 7 employees, the number shouldn't have said that. I'm looking for something I can hang my hat on. And when it shows from 5 to 12, that's 7 employees, and then I hear that, well, maybe that isn't what we're really gonna do. Well, why would we have it in there?
I still, go ahead.
That's option 2, the staff, the second option is that 12 employees. And that was the fully staffed truck in Acme with all East Bay personnel. And that adds one more full-time to the Station 9 rotation.
Can I maybe jump in here? There needs to be 12 employees if we add a second ambulance. It depends on who is the employer of those
The sheet
employees.
right here.
Yeah.
What?
There has to be 12 employees if we run a East Bay ambulance in Acme. The difference between the 12 and the
9.
9 is who employs them.
No, it's 5 employees. If
No,
you-
look,
Look at the finance sheet that we were given.
We have 5
To stay the way
employees.
we are, it's 5 employees.
I think the difference is this financial sheet doesn't just show East Bay.
No, this one.
Which one,
Right
Glenn?
here, Glenn. This number 9 here.
Okay, but what does it say on top?
East Bay and Acme with Metro Driver
Okay,
is 9.
and if you go to all employees, it's 12.
Correct.
That's right.
So you're talking 4 employees, when you
Right,
take Acme,
right.
okay? And then if you go to
Yes.
Acme's, or East Bay supplying the other driver,
You are correct. It's 12 employees. The only difference on these numbers is who is the employer of 3 of those employees, whether it's a Metro driver being paid for direct by Acme to Metro, or if it's an East Bay driver being paid direct from East Bay. That's the discrepancy you are hearing.
A little bit of the confusion too is the amount of full-time employees as opposed to part-time.
Well, we don't specify a number of part-time, because we have a pool, we just know that we have a number of hours that we have to cover.
I know, but when you talk about a half more here, and then a full-time if you change it.
Oh, that
that's-
half is not part-time, that's a full-time
That's what
employee.
I'm saying.
Yeah.
That you throw out those numbers, and they're not just the employees, those are the full-time or part-time, and how you make the staffing works. And so sometimes
Right,
it looks like you've added another employee, but you haven't added another employee, you just made them a full-time instead of a part-time.
yeah, it's a full-time equivalent. Sure.
I guess if we see this come back, I propose that we eliminate Whitewater from this configuration. And what we're discussing is if this board wishes to contract for services to put an ambulance at 8. And if we propose to do that, are we going to do it totally as East Bay staffing? Or are we going to have Metro? I think Whitewater's requested, but it hasn't been a long-term request. It's just been, hey, you're doing this, let's throw us in too. Kind of what I'm thinking. I don't believe what I'm hearing from the board is, there's from some, I understand, but I'm hearing that if this is for consideration, it's for services contracted to Acme. I'm not sure that I'm in agreement to do that yet, but that's what I'm hearing.
not throw darts or anything, but if we're ever gonna do this again, I would like to see us get these papers a week ahead of time so we can actually look through them.
So tonight, the reason, one, is you weren't, this wasn't necessarily supposed to be picked through, we're here to present them to you, and that's why I'm asking about the August 9th meeting, because then you can take some time and take a look at those.
I'd like to get back to getting the packet a little bit more to be able to do that discussion. This is a big decision to make. I'm not comfortable moving forward tonight with a decision. I think if that was the case, my vote's no, because we haven't had the time to look at this any other way.
And I think I mentioned that, when I sent that out, is this is intended to, this is supposed to be presentation of the information, and what way does what are the board's questions and concerns? So, but I think with this information, you certainly have the information if you need to respond with any further questions. Maybe if you have another staffing question or an amount or something like that, let let myself know, let Nick know. You can email us both at the same time. That would be perfect. And we'll get you that information. And then we can put this on our August 9th agenda, if that works for the rest of the board.
Works for me.
The other option is if you want to have a special meeting.
Depends on what's on the agenda.
So on the agenda, you have the chart trail making a presentation, about 15 minutes. Housing North, making a presentation as well. We've told them about 15 minutes. We have the conditional rezoning of the property just west of here.
So that's 3 hours.
That's been the track record, huh?
This isn't the planning commission.
I've said there are 2 of those already.
And
Sorry.
I am blanking on the fourth. The metro budgets, the emergency service budgets, yeah. Which, I mean, that's fine, we could tie this right in. I mean, we'll be looking at solely the 2022 budgets as we move forward, but we can obviously have this discussion and tangentially with that. Is that fine, or do you prefer a special meeting?
Well, we're limited on time to do a special meeting because we're already into August. It would have to be after the August 9th meeting. We still have to have a public hearing to accept our EMS budgets. That has to be done at the beginning of September. I think adding a special meeting from here until the beginning of September is going to be hard to get a quorum.
Okay, I think it's doable that we could do that on the 9th.
Or if not, we have a special meeting. I
Okay,
mean,
all right. Does anyone have any other questions for Nick or Doug or Pat?
On this capital improvement plan spreadsheet, is it correct that ambulance 1 is the current primary?
Correct.
Ambulance 2 is the one being replaced this year,
Correct.
and ambulance 3 is the one that's scheduled to be going out to pasture? Okay.
I will follow up and give you, I can't even remember who requested it, but, oh, am I doing you, Matt? Which line items feed into that kind of synthesized expense list? Okay, with that, are we, public comment, any public comment? Okay, seeing no public comment, and it is about, is that 8:50, did I see?
48.
8:48. We'll call the meeting adjourned if there's no objection. Have a good night, everybody.